Hi, thanks for coming by, seeing your friend Christine. I've been asked to do some demonstrations for nerve glides for the arms. So I'll start here with talking about what I'm going to do, and then I have to back up so you can see how to do this. So we'll start with the median nerve. And the key for these nerve glides is stop before there's pain. Don't push through tension or tightness. Some people take a few times to go, oh, is that what it feels like? Because we're used to pushing past our boundaries. Subtleties usually escape us in order to get something done. And the nerves don't like to be pushed past their boundaries. The brain can then decide, based on pain neuroscience research, that if you push too hard, too fast, for too long, the brain says, okay, I'm going to shut blood flow off to that nerve. And then you can't repair. Unless you start every 2 days with a new pattern. So we can start healing ourselves with pain being the message that comes differently from the brain every 2 days. I found it also works for people who have tingling, numbness, sensory deficits that I'll have them do both sides of the arms. Like say one side's not as bad as the other, have them start with that one so that the brain can identify what it should feel like and the fluidity of the movement, and then do the other side and go back and forth. Let me show you why. We're working on the homunculus. We're working on this part of the brain here for sensory and motor repatterning, and it takes time and patience. So the recommendation for these nerve glides, and this is going to be arm based, so starting at the arm, shoulder versus the hand, is a few times. I usually suggest 2 to 3 every hour. Okay, so here's the start position. You're moving your hand out, away. Full range is here. And you can turn towards the arm. That shortens the nerve. And then come back. So that's the goal. But say that you have discomfort starting here. You just come right back to start. I ask people to take a deep breath at the start position just to reset the nervous system. And maybe you can go a little further and then come back. And then one more. Maybe you can go even further this time and come back. And there's the 3 on each side. It doesn't take long. It's just repatterning the brain with the sensory information coming from the periphery. So that's the median nerve glide. If you like it, just hit that thumbs up. It gets it easier to access for you because I'm a newbie on YouTube. And if you hit subscribe, then you can also access all the other things I've done so far and then play around in there and see what you like. All right, take care. Thanks for coming.